Morning, students. As we are discussing the mechanism of respiration, one more important factor we are going to speak today in this particular session. As already I have told you that I have divided these physical properties which are related to the mechanism of respiration. Each property or each physical property is responsible in some or other way affecting the mechanism of respiration. So they are very much important to understand for understanding the mechanism of respiration also. And one of the important property which we are going to see in this particular section is lung compliance. So what exactly is lung compliance? You know that the process of respiration is related to lungs and the expansivity of the lungs. So we create a negative pressure, and this negative pressure is created by expansion of the lungs and the thoracic wall. Now, the ability of the lungs to expand is expressed using this particular term or this particular measure, which is known as lung compliance. The lung compliance is a volume change per unit pressure change, and it is represented as delta V upon delta E. So, whatever pressure change is going to occur due to the mechanics of respiration, the volume will be changed accordingly. So the expansibility of the lungs is measured by this particular physical property. So it is a very much important property. Now this compliance will be of two types. Lungs and the thoracic wall combined whenever the lungs inside the thorax are present. So that is normal physiological structure of the respiratory system. So you always have the combined compliance. So you have the lungs also having the ability to expand, and the thoracic wall also is having the ability to expand. Or many a times the compliance of the lungs alone is measured for experimental purpose or the ability, where only the lungs is responsible for the expansion of the volume to create a change in the volume. So this compliance can be of two types: combined lungs and thoracic wall and lungs only compliance. Now let us see one by one. So if you have the compliance measurement of lungs and the thoracic wall together, most of the times it is due to the viscous and elastic tissues which are present in the lungs and the thoracic wall. We know that these are the anatomical structures which are formed by elastic tissues and viscous tissues. So you have both of these anatomical structures, and the lungs and the thoracic wall have the major because they are expansive. So this is elastic properties of lungs and thoracic wall. They allow these structures to expand to a certain volume due to change in pressure. So whenever there is increase in pressure, they will allow a change in the volume. And this change in the volume normally is around 0.13 liters per centimeter of water pressure. So this is a normal compliance of the lungs and the thoracic wall together. If you consider only the compliance of lungs, the expansibility of the lungs alone, it is found to be somewhat more than the combined. It is around 0.22 liters per centimeter of water. So why it is more? Because lung tissue itself is formed into elastic fibers, we all know. But these elastic tissues, they are specifically arranged in a knitted manner. So if you see the structure of the nylon socks, it has a particular arrangement, knitted arrangement, and due to that, the stretchability for the nylon socks will be very much firm. So if you lose the stretchability of these nylon socks, these elastic properties of these socks also will be lost. Same thing is applied to the lungs also. They have a specific knitted arrangement of these elastic fibers. So completely the tissue is formed of elastic fibers, and again they are knitted in a specific arrangement like the nylon socks. Due to that, the expansibility of the lungs alone will be much more. That is around 0.22 liters per centimeter of water. So these are the two important types of compliance. Now Now, these compliance the responsibility of the lungs can be affected by various factors. On a whole, these are some of the factors which are commonly affecting the expansibility, the lung compliance. The first one is lung volume. The bigger the lungs, the larger is the compliance. So you know that the mountain dwellers, those who are residing at the mountains, they will be having the large thoracic volume. So if you have the large lung volume, so if you have large lungs, if you have large thoracic volume, definitely the expansibility of the compliance of the lungs will be much more. And that gives the more positive mechanism of respiration. And the second important factor is the pulmonary blood volume. So the blood volume in the pulmonary vessel should be a continuous process. If you have a pulmonary venous congestion by any cause, suppose there are disorders which can cause the pulmonary congestion, that is decrease in the pulmonary blood volume, that will decrease the responsibility, the compliance. Age also is going to affect this compliance. As the age advances, the responsibility, the elastic properties are going to lose and the responsibility will decrease. There are some diseases which cause the restriction of chest expansion. So whenever there is restriction of the chest expansion, that can also temporarily block the expansion of the lungs and the thoracic wall, and it will cause a change in compliance. Suppose there is a recent ventilatory history. For example, you have hypoventilation, you have hyperventilation, or you may be suffering from some disorders that is going to affect the compliance. So on a large, these are the factors which are affecting the lung compliance. Many times, low compliance is seen. What is low compliance? Is that the volume change per unit pressure change is low. So you have the pressure change, but the expected change in the volume is much smaller. The lungs are stiff and they are resistant to expansion. So whatever conditions which are causing the stiffness of the lungs or resistant conditions to expansion of the lungs will lead to low compliance, and the patient will have low lung volumes and low minute ventilation. The clinical conditions that decreases the lung compliance are atelectasis, ARDS, tension pneumothorax, obesity, retained secretions. So if you are going through all these things, what they are causing is they are causing the stiffness of the lungs. And these stiffness, suppose for example, we have seen the obesity, we have seen the tension pneumothorax, where you get the air outside the thorax. That restricts the expansion of the lungs. So in these conditions, the compliance will be low. There may be some conditions where there is spasm. So like airway obstruction, bronchospasm, or sometimes the patient is on endotracheal tube. And this endotracheal tube, if it is kinked, then that can cause the compliance to be low. So these are the common conditions in which the compliance becomes low. There are sometimes you have the high compliance. So the volume change is large per unit pressure change. So you get a large amount of volume change for a per unit pressure change. In this high compliance situation, the exhalation is incomplete because it is a high pressure change. So it has a high volume change, and the elastic recoil of the lungs will not be complete, and due to that, the exhalation process will be incomplete. Now, usually these conditions are seen whenever the functional residual capacity is increased. So what is functional residual capacity? In the next session, we are going to discuss. But this is the amount of air which is inside the lungs, even if you are not expiring or expiring. So this is a residual capacity. It is always there. So if that residual capacity is increased in patients, then you get this high compliance. And this is seen in obstructive lung diseases, airflow obstruction, incomplete exhalation, or the conditions where you get more gas exchange. And one of the important conditions is emphysema, when there is destruction of the lung tissue, causing enlargement of terminal and respiratory bronchioles, so that the air will be trapped in the this coalescing of the alveoli. So alveoli which are smaller, they will be coalesced, and a larger alveoli will be formed, and air will be trapped inside, and there will be impairment of the gas exchange. And in these conditions, high compliance is seen. So, in summary, you have these factors affecting the compliance. If it is a combined compliance, it is decreased in pulmonary congestion, pulmonary fibrosis, pulmonary edema, or it may be increased in emphysema or old age. Then there are factors which are affecting the compliance of lungs. Lung poisoning. It is very important factor. If you have only one lung, nowadays the lung transplants are very common. So if you have one lung, then definitely the compliance of the lungs is affected. Then it depends on the phase of respiratory cycle also. So the compliance is more in cases of deflation, it is less in inflation. It is affected by gravity also. In the upright position, the compliance is less at apices as they are more distended alveoli at the apex. So they are more aerated, and due to that, the compliance at this particular apex of the tissue is more. Sorry, it is less due to the effect of gravity. Then very important factor which affects the compliance is surface tension. So that surface tension also is affected, affecting the lung compliance. So these are, in summary, the factors which are affecting the lung compliance. Now coming to the measurement of lung compliance, those persons or those students who are interested in doing medicine can be TB chest, or nowadays as this respiratory system is of course now very much studied factor. Now if you want to do the super specialty, if you want to be an intensivist, all these measurements and all these small physical properties of the any of the system, they are very much important. As I'm going to discuss only the respiratory system, these are the things where we can study it much more. So those persons who are interested in doing all these things can read it again very carefully how these are done, and you can ask any senior physicians. These are the properties, the physical properties of any of the functional system of the body, which if you understand these properties, a very broad idea regarding the disease process you can get. So this is how there are some factors like pulmonary function test by which you can measure its lung compliance. And in these pulmonary function tests, the subject is asked to inhale and exhale. And a record is often like this. So you get these loop type of recordings, and these are known as pressure volume loops. So during inspiration and during expiration, the graph is recorded. On the horizontal axis, you get the pressure change, and on the vertical axis, you get the lung volume change. And never these is a straight line, so it is always a loop form, and this is known as pressure volume loop. Depending on these, we can have an idea regarding the expansibility of the lungs. This is a routine investigation which is very commonly done by the pulmonary chest physicians. So this you can study again in detail. Thank you very much.